Okay, let's discuss naman yung inflammation. Bakit at risk tayo sa mga different diseases kapag tayo ay obese or marami tayong excess body fat? So remember, any excess body fat in our body triggers inflammation. May tinatawag tayong inflammation switch na located sa part ng brain natin na tinatawag na hypothalamus. Nagsi-switch on itong inflammation switch kapag chronic eating. Meron tayong chronic eating flips on the switch. So, 'di ba? So, ano 'yan sa eating habits natin, no. Kapag chronic eating tayo, prone tayo sa mga diseases because of this inflammation switch sa ating hypothalamus area, and plus marami tayong excess fat, 'di ba? We discussed that excess fat is this itong mga fat na to is storage sila ng toxin. So, this leads to weight gain and insulin resistance. So, kapag kung chronic eating tayo, no, mindless eating na tinatawag, no, this will lead to weight gain and insulin resistance. So, we have to balance our diet. Since kung overweight tayo, alam na natin ngayon na mataas din ang level ng toxin natin sa katawan dahil nga naka-store sa fat cell natin ang mga toxin. Now that we know this, na prone tayo sa mga inflammation and mga certain diseases na diniscuss natin kanina, we have to consider now adding elements of anti-inflammatory diet. Ano tong mga anti-inflammatory diet? Lahat ng food rich in antioxidant. Paano natin malalaman na rich ang food in antioxidant? Lahat ng fruits and vegetables na colorful, they have all these phytochemicals that serve as antioxidant sa ating katawan. So what is the secret here? Eat a variety of fruits and vegetables. Okay, so let's discuss now what are the diseases associated with excessive weight. Because of this nga, prone tayo sa mga inflammation kapag may excess body fat tayo. One example is yung cardiovascular disease, like yung heart disease, stroke, and hypertension. So talaga makikita natin to sa rate or sa record na ang mas mabigat tayo, mas maraming body fat, ito yung prone tayo sa mga heart disease, stroke, and hypertension. Diabetes, no? Karamihan ng mga overweight, meron silang insulin resistance, no? Ang insulin resistance, hindi kagad, maaring merong insulin resistance na tayo, but wala pa tayong yung hindi pa tayo categorized as diabetic. Pero nagde-develop na ang insulin resistance sa katawan natin. Pwede rin tayong maging at risk of musculoskeletal disorders like osteoarthritis or other inflammatory diseases like arthritis. Some cancers like endometrial, breast, ovarian, prostate, liver, gallbladder, kidney, and colon cancer. Gallbladder disease. So, prone ng mga overweight sa mga gallbladder disease. Infertility, no? Marami na may mga case kami kapag ka-overweight, mahirap magbuntis. And sleep apnea. Okay, so let's discuss hidden hunger. What is a hidden hunger? Hidden hunger is also known as micronutrient deficiencies. Kung minsan nagbibiro tayo, huwag ka nang kumain, malusog ka naman kasi mataba siya or obese siya or overweight siya. But the truth is, hindi ibig sabihin na overweight tayo or obese tayo, we are healthy, hindi na natin kailangan tong micronutrients na to. Why? You can be obese but you are what we call malnourished. Ang malnourished, hindi lang sila yung mga payat or parang kulang sa pagkain. Pag sinabing malnourished, hindi sufficient yung nutrition mo sa katawan. And how is this happen? Kapag kumakain tayo ng food na high in energy density but low in nutrient density. So anong ibig sabihin nito? Itong mga foods na to, ito yung mga kinakain natin sa fast food, sa mga convenience store, mga ready-to-eat meals. They are high in energy but low in nutrient density. So, at risk din ang mga obese and overweight to have a micronutrient deficiencies. So, dahil nga, not enough vitamins and minerals ang mga kinakain natin. So one factor then that associated with obesity and overweight is low birth weight. Anong ibig sabihin nito? According sa studies, ang mga batang ipinanganak na mababa ang timbang like less than 5 pounds or 8 ounce or 2.5 kilogram, paglaki nila, mas prone sila sa pagtaba. Why? It's very important yung tinatawag na in utero environment. So, ibig sabihin nun, yung mother nila, itong baby na to, during pregnancy, deprived of nutrients and energy. So, kapag naipanganak na sila, their body is parang parang uhaw sa nutrients. So, ano nangyayari? Once they are exposed in rich nutrient environment, bigla silang lolobo. Ewan ko kung nakakita na kayo noon, ang liit-liit ng ipinanganak pero nakikita natin sobra naman ang paglaki. This is the reason why that is happening. So this is also the reason why lahat ng mga buntis, lahat ng mga pregnant women should focus on what they are eating para sa kanila and para na rin sa baby nila. So kapag so malaking factor talaga yung mother's knowledge in during pregnancy. Okay? So kapag nangyari ito, syempre ang ating mga anak at risk of obesity and diabetes paglaki. Syempre kasi overweight adolescent, overweight baby may become overweight adolescent and overweight adolescent will become overweight adults. So, mahihirapan na silang magpapayat. Okay. So, now, let's discuss about metabolic rate. Itong metabolic rate na to is also what we call metabolism ng ating katawan. Meron tayong tinatawag na resting metabolic rate. Yung kahit wala tayong ginagawa, kahit natutulog lang tayo, kahit nakahiga lang tayo, hindi tayo gumagalaw, still our body use energy. So resting metabolic rate is around 60 to 70% of energy expenditure. So malaki siya. So ibig sabihin nito kung ang caloric intake mo is around, let's say, 1,000. So 600 to 700 calories, ini-spend mo na sa resting metabolic rate lang. Ano to? Ito yung mga ginagamit ng internal organs natin, ng cells natin to function. No? So parang ano yan, parang car, may gasoline. Pag tinurn on mo yung engine, umaandar siya, gumagamit siya ng gas. But you see that the car is not running. Yung ganun yun ang tinatawag na resting metabolic rate. Gumagamit ka ng energy even without moving. So with this alone, we know that pwede pala tayong magpapayat. How? By lowering our energy intake. Para yung energy intake natin will supply yung enough lang for resting metabolic rate. Pero that is not possible yan, pero it's not a good way of losing weight and to have a healthy weight. But possible kang pumayat just supplying for this resting metabolic rate. And the resting metabolic rate decreases with age. So habang tumatanda tayo, habang nag-age tayo, bumabagal ito. So sad to say, kaya dapat mas maging active tayo kasi as we age, mas bumabagal ang metabolism, dapat maging mas active tayo para mas marami ang ma-burn natin sa katawan. And this is also decreases if we have restricted energy intake. Anong ibig sabihin nito? 'Di ba may mga nagyo-yo-yo diet? Kakain ngayon ng marami, sasabihin ganon. Hindi, for the whole week, next week, hindi ako kakain. So they put their body in starvation mode. So according to sa research, Just doing that in 2 weeks alone, yung parang ini-starve mo yung sarili mo. Yung magsiswitch yung body mo into starvation mode at bababa pa yung metabolic rate mo by 15%. So mas babagal lalo pa ang metabolism. So it's not good. Na nagyo-yo-yo diet tayo. Kaya mas maraming nadi-disappoint dun, mas nakaka-disappoint yung yo-yo diet kasi mas tumataba sila. They do not know na mas pinababagal nila ang metabolismo nila. May tinatawag naman tayong activity thermogenesis. So this is naman, yung mga energy expenditure during naman active, when we are active, no? And this comprise naman 15 to 30% of energy expenditure. So we control this. Itong 15 to 30%. Ibig sabihin, the more you become active, mas marami kang energy na ginagamit. So this is the reason why yung iba talagang just to lose weight and nag-exercise na at the same time, they also watch their diet. So magandang combination siya. So meron din tayong tinatawag non-exercise activity thermogenesis. Ano ibig sabihin nito? Gumagalaw tayo pero di tayo nag-exercise. Katulad na, nagsasalita ako, hindi ako nag-exercise. Ito yung tinatawag non-exercise activity thermogenesis. Na gumagamit ng energy ang aking katawan. So if you are sedentary, you can use this NEAT na tinatawag, non-exercise activity thermogenesis. Anong ibig sabihin? If you don't have time to go to the gym and exercise, sobrang busy ka, pero ang trabaho mo is nasa desk ka the whole day, you can simply stretch your body, move, twist, or tap your foot just to do more activities nang hindi nag-exercise kasi gumagamit din tayo ng energy niyan. So, it is possible na mag-lose ka ng weight without going to the gym by combining this knowledge, no? So, sedentary ka. Decrease mo yung energy intake mo. Just supply the requirement for the resting metabolic rate and also for the requirement for non-exercise activity thermogenesis and pwede kang mag-lose weight. Okay? Okay, so yung all activity except sleeping, eating, and exercise. Okay, so fun fact. So NEAT may have a significant impact on your energy expenditure, especially in a sedentary lifestyle. So the secret is stand, use the stairs, get the foot tapping, and move around sa place mo. The secret is you move, so your body will use energy. Okay, so let's discuss naman the brain, neurotransmitters, and gut hormones. So these are the hormones that affects our weight. Number one is the lipoprotein or lipase na tinatawag. They are the one that moves your lipid or your fats from the blood into adipose tissue or cell. We have leptin. Ang leptin is this contributes to long-term fullness. So decreases appetite. So if mataas ang leptin sa katawan mo, you feel parang busog palagi at wala kang ganang kumain. Surprisingly, higher sa mga obese population to yung leptin. But nagkakaroon sila ng resistance, nade-develop ang resistance. Kaya na-override din tong leptin. Ang ghrelin naman is a hormone na tinatawag na hunger hormone. So kapag mataas ang ghrelin sa katawan mo, mas parang palaging nararamdaman mo yung gutom ka palagi. So it increases your appetite. So it triggers your hunger pangs and it drops your metabolism. It drops in metabolism. Okay, so fun fact, dieting, this is based on research. Dieting increases ghrelin. So, ibig sabihin, mas nagta-diet ka, mas na tumataas yung hunger pangs mo, yung gutom mo. And it increases yung carbohydrate craving dahil sa neuropeptide Y. So that is why, 'di ba, maraming napo-frustrate. Nagda-diet naman ako, pero ba't parang gutom na gutom ako, mas lalo akong kumakain, mas lalo akong tumataba. This is because of these hormones. So let's continue. Another neurotransmitter is dopamine. So these play a role in the reinforcement of reinforcement properties of food. So they have found out na kapag ka mababa yung serotonin mo, pero mataas ang neuropeptide Y, this will make you yung mag-crave ka for carbohydrates. So tataas yung intake mo ng carbohydrates. Another hormone is the corticotropin releasing factor. So this one released naman during exercise. And importante din naman siya sa tinatawag na pag-lose ng weight. Thyroid hormones, ito, importante ito. The thyroid hormones modulate tissue responsiveness to catecholamines. Yung catecholamines, ito yung mga neurotransmitter na nabanggit ko kanina. So, ano ibig sabihin nito? Kapag ang thyroid hormone mo is nagpa-fluctuate, no? Minsan, di ba, may hypothyroidism and hyperthyroidism. Pag sinabing hypo, ibig sabihin, mabagal siya. Kaya mas tumataba ka. Kaya yung iba, napoprostrate sila, hindi makapag-diet, hindi nila alam, mayroon palang problem with their thyroid hormones, no? Kaya mahirap magpapayat talaga ang mga taong may thyroid problem, especially if their thyroid is hypoactive. Kapag hyperactive naman ang thyroid mo, mas mabilis ang metabolism mo. So, mas mapayat. Ito naman yung kahit kain ng kain, hindi sila tumataba dahil hyperactive ang thyroid nila. So, kapag nasa menopause stage na, talagang normal na nagpa-fluctuate ang thyroid hormones, kaya it is advisable na to test regularly. Okay, to understand further, bakit nagkakaroon ng insulin resistance kapag tayo ay overweight? So yung insulin is a hormone, so it's like a lock-in mechanism to. Insulin hormone siya necessary for glucose para pumasok siya sa cell ng body natin at para magamit ng sa cell ng sa cell, no, para magamit siya ng cell for energy. So what happens kapag kumakain tayo, lalo na kapag rich in sugar yung kinakain natin, tumataas ang sugar level sa ating bloodstream. Okay, so for example, this is the bloodstream, no? Tumataas yung sugar. So, merong feedback mechanism ang ating brain. Kapag na-sense ng ating brain na mataas ang sugar, uutusan niya ang pancreas to release insulin para magamit ng cell. Kaya, kapag tumataas ang sugar natin sa katawan, tumataas din yung level ng insulin. Okay. So this is how it works. So yung insulin is like a key. Hindi makakapasok yung sugar, etong sugar, sa cell kung walang insulin. So may receptor tong insulin. Yung cell natin, may receptor siya for insulin. So once na pumasok itong parang lock and key, mag-o-open tong channel for sugar. So yung insulin is like the key that opens the body cell to allow sugar in. So what happens? According sa studies, may mga instances kasi na tumataas ang ating sugar intake like this one, di ba? Compare mo siya sa 3 slices ng bread, 3.5 slices of bread, mababa lang yung sugar. But parang equal pala. In this presentation, parang yung 500 ml Coke is equal to 3.5 slices of bread. Pero kasi, mas madaling kainin or i-ingest yung Coke, di ba? kesa kumain tayo ng 3.5 slices of bread. So what happened? Tumataas ang insulin natin sa blood. Nag-i-spike pag kumakain tayo ng high in sugar. No? Anong nangyayari dito? Okay. So nagkakaroon ng parang siyang kapag mataas ang insulin level, tumataas din ang abdominal fat. Why? Let's go back to this example. Kapag obese tayo, okay. Kapag obese, itong lock-in key mechanism na to, hindi siya nagpa-function properly. So, they have found out pala, kapag obese tayo, di ba, mataas ang inflammation kapag obese dahil mataas ang toxin level sa excess fat. So, ang nangyayari, nagkakaroon ng inflammatory high inflammation yung environment ng ating cell. And nagiging rigid itong outer covering ng ating cell, kaya hindi pumapasok ang insulin. Yun ang nangyayari kapag meron tinatawag na insulin resistance. So the insulin resistance is common sa mga obese. So pag may high insulin level, magkakaroon ng increased abdominal fat. Why? Dahil hindi nagagamit ang mga glucose o sugar ng cell, ang nangyayari, mas nade-deposit sila as fat. Ayan. So ito ang tinatawag na hyperinsulinemia. So the cell is no longer sensitive sa insulin and wala ng glucose or hindi na magamit ang glucose. Cell becomes resistant. So hyperinsulinemia, so mataas ang cell, ang insulin level sa body, increased abdominal fat, and this will result to insulin resistance. And yung body magko-compensate kasi may feedback mechanism ng katawan natin. So, akala yung brain, hindi nagagamit ang insulin. Kulang hindi nagagamit ng cell ang glucose. So, dagdagan natin ng insulin. So, body makes more insulin, pero hindi yun ang pinaka-problem. Ang problem is because of insensitivity na ng cell natin sa insulin. So, parang ano lang siya, paikot-ikot lang siya kapag excess ang visceral fat natin sa katawan. And kapag hindi natin regulate ang ating food intake. Okay. So, this is the reason why kahit na nag-e-exercise ka, kahit na gumagalaw, hindi nagagamit yung sugar sa mga mayroong hyperinsulinemia. Mataas ang insulin level sa blood. Okay, so let's discuss the dietary factors. So, taste of food evokes pleasure response. No, 'di ba? Yung check kung merong pumapasok. Okay. And also, availability of food may contribute to increased intake. Ano ibig sabihin nito? Ito lang pandemic, 'di ba? Very accessible na ang food kasi ang food na ang lumalapit sa atin. Dito lang sa amin magte-text lang yung kapitbahay namin na ate, ano ka ba, mag-order ka ba? Paglabas mo lang may nagluluto kaagad ng mga pagkain. So, kahit may tinatawag tayong self-control, pero kapag available ang food, napapakain tayo. Anong concept ang pwede nating kunin dito? Para maging healthy ang diet natin, make sure na ang mga unhealthy food ay hindi available sa bahay natin. So when we do our groceries, hindi tayo dapat nag-grocery or nag-i-stock ng mga chips, ng mga food na unhealthy for us. Kasi napapakain tayo. So people eat more when there is variety of food kesa sa single choice. So, 'di ba? Kaya mas maraming tumataba kapag pumupunta tayo doon sa eat all you can, 'di ba? Buti na lang wala na ngayon. Dahil sa pandemic, wala na, ano na lang, no? Hindi na tayo makakapunta sa mga ganong place. Bakit ito nangyayari, no? May tinatawag tayong sensory specific satiety. Ibig sabihin, nagliles yung panlasa natin or yung craving natin sa certain food kapag paulit-ulit yon, para kang nagsasawa. Ang good side nito, ano siya? So, na-override yung choice natin kapag may maraming variety of food. Yung good side nito is napapakain tayo ng mga different food. But yung bad side naman yan is yun nga. Although kumakain tayo ng different variety of food, so nagkakaroon tayong na balanced diet, but napaparami naman ang kain natin. So it contributes to the increase of contributes to for you to be an obese or overweight. So yun nga, it can lead to overconsumption. Okay, so let's discuss these lifestyle factors. So yung overweight, yung obesity, it's not only yung ating pagkain ng marami. May mga lifestyle factors that contributes to being obese or overweight. So yun, number 1 is physical activity. So we have learned that kailangan din nating mas mabilis ang paggamit natin ng energy kung mas gumagalaw tayo, di ba? So kapag decrease or low energy yung pag sedentary tayo, syempre mas less yung energy expenditure. Pero kapag kain naman tayo ng kain, so hindi siya balance. Yung food intake hindi balance naman sa energy expenditure. So nagde-deposit tayo ng fat sa katawan. Like yung example nito, kung couch potato tayo, yung screen watching lang, or passive commuting, although hindi na natin ginagawa yan, di ba? Imbes na yung 500 or 100 meter walk, kung available ang tricycle, magta-tricycle tayo kaysa lumakad tayo. Kahit man lang yung 1 kilometer, kung available na may sasakyan, hindi tayo naglalakad. So tinatawag na passive commuting. So have you heard this 10,000 steps? Di ba? Nauso to eh. Di ba? Actually, itong 10,000 steps is not rule. It's not something that we talaga to follow. It's just this is just promoting na maging active tayo. If you can do 20,000 steps, much better, di ba? Pero hindi natin sasabihin na ay naka 10,000 na ako, hindi na ako mag-exercise. What is the key? The more you move, the more energy that you use. So if you want to lose weight, mas dagdagan mo ang activity mo. So move as much as possible. Okay. So behavior factors naman that contributes to weight gain or weight loss. So behavior modification is the key. So napag-aralan, no, hindi lang yung diet. Sa umpisa, pagka may ginagawa tayong program to lose weight, nakikita natin may improvement. But kakatagalan, hindi na natin to nasusustain because of behavior. So we need behavior modification. So anong ibig sabihin? Restructuring of your environment. So awareness of eating behavior triggers. So kung alam mo na addictive ka sa mga sweets, then wag kang mag-grocery at punuin mo yung iyong kusina ng mga sweets. I-pack mo doon o ilagay mo doon mga healthy foods. And you can use tools like a food journal. So para malaman mo ano yung mga kinakain mo, baka yun na lang ang kinakain mo and na pala yun, no? May overconsumption na doon. So nagko-contribute yun. Food journal kasi doon mo makikita, palagi pala akong kumakain ng carbohydrates. Napapa 3 cup of rice pala ako. Ganon. Or panay soft drinks pala ako, ang taas ng sugar. So, importante to. If we are really serious in losing weight, we should do this or use this tool. So may tinatawag na self-control versus proximity control, no? Parang kapag yung mga obese and overweight, they feel na parang wala kasi akong self-control. But this is not the kasi reality eh. We are all human. Anyone, kapag pinresent mo in front of them yung delicious pizza, kakain at kakain yan. Kahit ako, guilty ako dyan. Nutritionist ako, pero kapag ka may handaan, merong ganong pagkain na alam ko, rich and saturated fat, tumitikim ako. So, di ba? So, it's not ang tamang way is proximity control, no? So, yun nga, ialisin mo yung sarili mo doon sa mga bagay that will lead you into overeating or overconsumption of unhealthy food. So you have to change your environment. So discipline ang kailangan, no? Ang importante, we should not challenge our self-control kasi baka tayo mag-fail. Okay. So another factor of that contributes to our weight gain or weight loss is genetic, no? So genetics is a study of genes and how we inherit traits from our ancestor. So, but it doesn't mean na kapag, di ba, kasi ito malalaman natin na very important to kapag once we go to a doctor and tinatanong di ba nila yung history natin, family history. So, kung may mga sakit ba yung parents mo or may mga certain diseases or any condition, no? Kasi you have if marong sakit yung family mo, so halimbawa, it runs yung cancer or yung hypertension, diabetes they run in your family, mataas yung mataas yung risk na pwede kang magkaroon na ma-develop mo rin yon. But it doesn't mean na may ganong history sa family mo is this seal the fate seal the fate of your health, no? Ano yan eh, it's not only the genes, may other factors yan. Yung genetics plus lifestyle and plus environment is equal to the outcome of your health. Paano natin to maiintindihan pa? It's like, let's use the analogy of yung gun. So yung genes mo, it's like yan eh, parang yung genetic makeup mo, it's like loading a gun. Parang you are loading a gun but your lifestyle is the one that pulls the trigger. So ibig sabihin, as long as yung lifestyle mo is okay, hindi mo matitrigger yung genes sa katawan mo to have those certain diseases na meron ang family mo. So anong secret? Huwag nating isipin na huwag tayong matakot na merong cancer sa family, may namatay si tito, si tita, si lolo, si lola sa heart disease, yun na rin ang kakahinatnan natin. It's still lifestyle. Malaking bagay ang lifestyle, no? So, ang pinaka-question, di ba, ng karamihan is obesity genetic? Okay. So, the fun fact is genes are what load the gun, but lifestyle pulls the trigger. So, kung ano man yung meron sa genes mo na that predispose you to different diseases, yon, it's something na you have to consider para yung lifestyle mo is yung lifestyle mo is something na hindi ka malilid para ma-trigger yung mga genes na to sa katawan. Okay, let's study further about genetics. So, small defects in genetics can contribute to weight gain. Kasi meron tayong tinatawag na merong short and long-term signals like yung satiety and hunger natin. Syempre, genes yan na namana natin sa ating mga magulang, and tong long-term feedback or set point. Meron din namana din natin yung number and size of fat cell natin. So hindi natin mababago yan kung talagang marami kang fat cell sa katawan, namana mo kasi yan sa magulang mo. So kung konti or kung talagang matataba yung fat cell mo, it's because of your genes. But still, meron ka pa ring magagawang paraan through your lifestyle. And also yung regional distribution of body fat, 'di ba? May mga nakikita tayong tao na talagang mapayat sila sa yung torso nila pero mataba ang kanilang mga legs. O kaya naman payat ang mga extremities nila pero ang laki ng torso nila. So it's because of factor nun, it's because of your genes. And also your resting metabolic rate. So, kung mabagal yan, kung yung genes mo is because mabagal yan, mabagal talaga. So, importanteng malaman natin to so we can adjust our lifestyle para ma-reach natin yung healthy weight that we need to reach. Okay, tingnan ko lang kung may pumapasok. Okay. So, may tinatawag tayong OB gene. This one produce leptin na tinatawag yung ating, this one increase satiety. May tinatawag din tayong adiponectin gene. This one codes for adiponectin and helps the body respond to insulin. May tinatawag din tayong fat mass and obesity gene. This one predisposes individuals to diabetes. And because of this is due to effect on body mass. You don't have to memorize this. I'm just presenting sa inyo na it's not simple. Ang weight management and weight loss is not simple. It's a complex process na iba't ibang factors ang nagko-contribute. So they have found out that mutation in the OB gene and ADPOQ genes can result to obesity, especially in high saturated fat diet. So kapag palagi pala matataas ang diet natin sa saturated fat, ito yung mga kinakain natin sa fast food, nagkakaroon ng mutation sa OB gene natin. So anong OB gene? Nagpo-produce siya ng leptin. So mas tumataas ang nagkakaroon ng abnormal process sa mga genes na to. So these are the examples of the sources of saturated fat. Yung lard, yung skin, so sinong kumakain dito ng mga chicharon, yung mga balat, so saturated fat yan. Yung fat on meat, and yung mga dairies natin like cheese, yung butter, yung milk, they are saturated fat. Because these are recent years, no, they really see na napakalaki ng effect ng nutrition sa genes, no, sa switching on and off this yung mga different genes natin. So may tinatawag na tayo ngayong nutritional genomics. So nutritional genomics studies yung nutrition plus yung lifestyle choices para makita kung ano yung nasi-switch on or nasi-switch off at bakit tayo obese. And triggers kung ano yung mga abnormalities sa genes natin. So meron din na rin, no, meron na ring mga professionals that they recommend kung ano yung proper diet mo based dun sa genetic makeup you have. And may tinatawag na rin tayong genetic testing. So available na to. So ang importante dito, ano man yung kung we decide to have this genetic testing, it should be interpreted by a skilled professional, and whatever the result will be, ano yun it's not something na parang gagamitin mo lang siya so that you will adjust your lifestyle, no? Para kung you are predisposed to certain diseases, alam mo paano yung diet and nutrition na gagawin mo para hindi ma-develop yung sakit na yon. So other factors that contribute to our weight gain is medication. like yung mga diabetes meds, yung psychotropic, antidepressant, steroid, antihypertensive drugs, meron silang side effect ng weight gain. Ang alam ko, meron din yung mga pills, no? Medication for reproductive pagka may problem tayo sa reproduction. So nakakataba din sila. So ano yung importante dito? If you have gained a lot of weight since you started or change your chronic medication, you need to consult your doctor. Baka baka ito yung medication na yon na nagpapataba sa iyo na hindi mo alam. Lalo-lalo na kung you did not change any diet na meron ka or any activity at bigla kang tumaba.